and this is the title of our talk.
Yeah, so this is very exciting for me because it's really about empowering you and making a real difference in your life. And it's fun because I work with a scientist and we've been looking at what you can do to empower yourself. And I really think if you take this presentation seriously, you can really improve your quality of life, quantity of life, function, your mental health. There's so many things that you can actually do starting today that can make a difference. So I'm excited to share that science, and this could really kind of change your life.
Yes, so tonight is really going to be a portion of translational science,
Yeah.
really giving you some of the ingredients on which the program that we developed was predicated.
Yeah, agreed. I want to start out with the story of my uncle Skid, diagnosed at age 64 with a localized prostate cancer. He's a healthy guy, underwent the big surgery, prostatectomy, seemed to be doing well for a number of years. Undetectable PSA does not mean that there's no cancer cells in the body. I mean, hopefully you'll be cured of the undetectable PSA, but it's no guarantee. And then his PSA began to rise, which meant there were cancer cells left over. So 7 years after his surgery, he had radiation treatment. And again, it looked very promising. The kind of PSA melted away, but evidently there were some cancer cells in his body. And about 7 years after his radiation, he started hormone treatments. And the hormone treatments kept the cancer in check for an additional 7 years. And then he went on to some more specialized treatment for the last 3 years and had some complications. The takeaway from this is that he lived for 24 years from the time of his diagnosis. And I honestly think if he had taken our program and understood the science here, he actually could have changed his longevity, probably wouldn't have run into as many problems. And I'm going to try to argue that scientifically as to how you can potentially change your longevity, your quality of life, your mental health, your function, your happiness levels, and through the scientific program that we're talking about. Yeah. So as you know, 1 in 8 men will get a prostate cancer diagnosis in their lifetime. And if that adds up, it's about 26,000 men get diagnosed in Canada with prostate cancer, and about 4,600 die of prostate cancer. And what I'm trying to do is keep you guys, whoever's listening to this talk, in the former category, i.e. dying of something else and not dying of prostate cancer. So really, this is about how can you change your longevity, your chance of recurrence, and so on. And so how are we going to do that? We're going to do this by talking about how cancer cells become cancer cells and growth and transformation and so on within the bounds of the prostate cancer patient empowerment program and the science that we developed around this. And I'm excited about the part around offering you specific advice around diet and time-restricted eating and why strength training is so important and why you shouldn't sit so much and the power of having, getting a better night's sleep and so on. So really, the point is that there is some new science that I'm going to offer you that you can integrate into your life, really starting today or tomorrow type thing. And my lovely wife, who's the brilliant one here, is going to actually talk about some mental health too. So relationships and connection. And ultimately, we would like you to sign up for this free program, which is all home-based at PCPEP.org. It's a research trial right now, but it could be, you can get onto this program after the trial ends as well. So yeah. We also kind of put this in context. So I'm an oncologist. I treat prostate cancer, and I believe in something called complete prostate cancer care, which is also called integrative oncology. And what can you do to maximize your chances of recovery and get better and give yourself the best chance of cure, for instance? So obviously there's the big picture, understanding, information, and so on. And that happens within support groups. It happens by you doing your research. You need to kind of be proactive on that side of it by itself. Second thing is you need to be able to tap into the best care from what the medical system provides. And that's a whole set of knowledge and attitude that we're not going to cover tonight because that's part of integrative oncology. If you want me back for another talk or us back for another talk, we're happy to provide that. But we're actually going to focus on the empowerment piece.
Part of our program, we do have a talk from you about how do you get the best care from the medical system? How do you navigate your way from diagnosis until after treatment and way after?
And advocating for yourself and so on. So we're going to focus more on the physical aspect of this. And if everybody can, maybe Cody, I'm not sure if you can mute a microphone there. So that's the kind of the physical care we're talking about, but there's more to it than just the physical care. There's the healing at the level of the mind, because the mind does obviously influence the body. Nurturing a spiritual perspective that really can have a profound influence on your life. And really, I think life is about our relationships and so on. So why do we want to live? Why do we want to be better? To have better relationships. So I want you to take away this main idea, not letting potential cancer cells that are in your body to go from slow growing cancer cells to fast growing cells. So that's the whole crux of it. And the idea is it's damage or inflammation that starts out the normal cells within the prostate gland. They get enough damage, they turn into prostate cancer cells. And then if you get more and more damage to the slow growing cells, they turn into fast growing cells. And so what we're trying to do is prevent that from happening so that you can maximize your longevity if you're not cured of your prostate cancer. So you convert that by what's good for prevention of prostate cancer is good after you get a diagnosis. And then obviously what's known to cause prostate cancer or increase the risk of prostate cancer should be avoided. And I'm going to take you through the kind of the science and then offer some practical advice on that side. So prostate cancer occurs when some of the normal cells within your prostate gland begin to grow in an uncontrolled way. Now, it takes dozens of mistakes in a cell before it can become a prostate cancer. So each man has a different kind of set of mistakes. And so each man's cancer has a different personality. The majority, vast majority of prostate cancers are very slow, and therefore you have the opportunity to influence your longevity by not irritating the cells that may be left over. And just to kind of take that into the basic science then, so you think about each cell having the nucleus and the DNA, which I think as the control center and the words and sentences that tell the cell what to do. So that's the kind of genetic part of this. And then during replication, the parent cell is going to give the same book of instructions to the two daughter cells, right? So it's, if you have mistakes, if you have a bad playbook, you hand that bad playbook down to the next generation. And then if they have more mistakes in it, they hand it down to their grandkids. You know, it keeps on going forward. And so we're trying to minimize the mistakes in the cells. So how is a prostate cancer ultimately made? So it's the normal cell with dozens of mistakes. The mistakes can be created in three ways. You're born with the mistakes, such as genetic abnormality, which is pretty darn rare for prostate cancer. Mostly it's an accident as your cells are growing. So for instance, your prostate gland grows by a factor of 4 in your lifetime, and that's because those cells are multiplying. And so that, as it divides, there can be a mutation. And lastly, and what we're trying to do is the substances, carcinogens, for whatever way we have a carcinogen, go in and actually cause the damage in that cell. And then the cell replicates and passes it on to the daughter cell. So I put down a few here. So for instance, we know that firefighters are at higher risk because they're inhaling some smoke that actually causes the damage or is a carcinogen for prostate cancer.
So are police officers, for example?
Yes. Yeah. So problems with the cell's instruction. So I'll give you an example. So if the normal instruction from the cell is stop dividing after coming in contact with the lining of the prostate gland, that gets changed to keep on dividing after coming in contact with the lining of the prostate gland. Then you don't have a braking system within that, and the cell will just keep on growing. So that's an example of how a sentence can get modified and then put you at risk of dividing more cells. If the instruction, another one, if the instruction says, grow only if testosterone, which is the male hormone floating around in the bloodstream, lands on the receptor, which is this little kind of antenna on the outside edge of the cancer cell. If that's changed to grow even when testosterone is not on the receptor, so that's a scenario where the cell is growing without the signal. So it's kind of got a gas pedal on, and that would be what they call castrate resistant. Typically you need testosterone to grow, but now it's, you know, no testosterone in the cell is still growing. So that's castrate-resistant prostate cancer. This diagram is meant to show a change over decades.
I love this diagram.
Yeah.
The picture is really worth 1,000 words. Yeah. Have a look at this.
So the normal cells up top, that's you in your, teens, for instance. And as the years and the decades go by, you accumulate more and more and more damage until ultimately you get a cell that's kind of growing in an uncontrolled way. A tumor simply means a collection of cancer cells. And so that's the reason why we have this diagram, which is essentially, you're not going to get prostate cancers in your 30s and 40s, unlikely, because it takes so long for the damage to accumulate enough to actually cause a cancer cell. And that's why it's more of a diagnosis of the middle and older ages. So then what are the risk factors? And we're thinking about, we want to try to avoid these things that are causing the cancer if you have a cancer diagnosis, right? So you can't avoid being a male or, being older and having testosterone. And that's really why there's so many men with a prostate cancer diagnosis, is because, we're exposed to those changes, those turnovers all the time. We can't change our family history, right? So if you have a family history, for whatever reason, it doubles your risk or 5 times the risk if it's 2 first-degree relatives. But we can have an influence on diet, and I'm going to really talk about that shortly. We can avoid smoking. We can try to stay away from the chemicals, et cetera, et cetera. And then interesting, prostatitis means an inflammation of the normal gland. And again, we're going to talk about inflammation, the irritating chemicals that cause damage to the normal cells that can turn the cells into prostate cancer. So what is prostate cancer? The normal cell that's begun to grow in a fast and uncontrolled way, takes dozens of changes, and cancer by nature can permeate or grow into the surrounding normal tissue, or it can get into the lymph channels or the blood channels and kind of land at a distant spot and kind of go 1 to 2 to 4 to 8 cells and create what they call a metastasis. So that's the definition of malignancy. When the cells change even more, they grow even in the absence of testosterone. So that's kind of an end stage prostate cancer. We don't want to get to that phase of having, more and more damage to the cells, which what we're trying to avoid.
Right.
So this is interesting. So we essentially listed the countries around the world and looked at the incidence of prostate cancer per 100,000. Now, yes, maybe the US does more screening than these other countries, but Germany, Denmark, they all have much lower risk. And especially if you look to Asia, East Asian, and so on, there's something about the diet. People who emigrate to Hawaii, have the same genetics from Japan, but they would have a higher incidence of prostate cancer because of their poor diet, right? So we have this opportunity to learn to decrease our risk through this side of things. So this might be a downer slide, but I'm really suggesting you folks to minimize, for instance, red meat, especially if you're kind of got the charcoal and burning the hydrocarbons. There's also data, and my wife has done the systemic analysis saying eggs and dairy products increase risk. Yes, you can cheat sometimes. Trans fats, diets low in vegetables and alcohol. So, low in vegetables, yeah, and really trying to decrease your alcohol. So there's supplementation. They did a whole number of studies looking at if you're taking these extra supplements, and if you get too much folic acid or zinc in your supplementation, you actually increase your risk of prostate cancer. So again, there's something irritating about some of those supplements, and that's why we try to stay away from that as well. Interestingly, then, if we're carrying too much weight, and specifically if we got kind of too much of a big belly, the kind of abdominal fat, that is actually associated with increased risk of prostate cancer. So again, and men who have more weight typically on average have more aggressive prostate cancer than their thinner cousins. And we think that one of the things that happens there is that insulin becomes desensitized and we get more insulin spikes and something else called insulin-like growth factor. So there's chemicals in the blood that get released with sugary foods, and that chemical by itself causes the cells to turn over and grow faster, right? So again, the sugary diet is associated with higher cancer rates. Epigenetics. So we say change the soup. It's the chemicals around the actual cells that can have an influence on cell growth. So we want to change it to not drive the cell growth. And one of the major ideas here, and what Gabrielle and I have done together, is really thought about an anti-inflammatory lifestyle, because inflammation is like an irritation within the system. The chemicals are driving growth and driving damage all at the same time. It's the two factors together. So we've specifically designed to say, how is it that you can decrease the inflammation in your body, including within our relationships, including our mental health and how we look at the world. And that was part of the design of PCPEP.org. But partly we want you to be protected from cardiovascular disease and help you with side effects, et cetera, et cetera. But as part of it is the anti-inflammatory and all the benefits that has. So I'm just going to overview PC-PEP. So this is what it stands for, obviously, Prostate Cancer Patient Empowerment Program. 6 months. It's every day for 6 months, science-based. And it's emails that are coming every day and a little video, a little 3 to 5 minute video by us, the oncologists and psychology professor scientists. So I think that's the power of the program. Actually, it's interactive, but it's also very comprehensive. Like, we're really covering all the bases, teaching, encouraging, science of habit change. It's like, it's the whole schmoll. And a lot of the guys will watch their videos first thing in the morning, but you can see the list of the activities that we teach and integrate within every week. And I'm going to give you a little bit more of that, that information or we're going to give that to you. Gabrielle will also talk about the buddy system and the monthly video conference, Zoom conferences with us. So you can sign up for free right now. Actually, if you're going the trial, later, maybe pay-per-view, go to PCPEP.org. I'm showing you an image of the landing page. On the landing page is a 10-minute video that really outlines the program very clearly. And then there's lots of other information that you can pull off the navigation bars at the top there. So everybody, please recommend it to your friends. At least check it out, PCPEP.org. Okay, so this is the kind of guts of the program. On the right side of the screen is the emails. And you can see in the emails that we can't read it, but there are links, for instance, to the video that we would give each day and practicing a relaxation technique and pelvic floor and all the elements of the program. But I think part of the magic of this is actually the daily videos. I'll just kind of run that. So we're pushing vitamin D through and through. We're talking about a diet. We're talking about, the healthy stuff that you can eat as replacements. We're talking about connections, part of the guys from the Halifax support group there. So, so that's part of it. Oops. I was just going to review the anti-prostate cancer diet. So I'm trying to give you an overview. We're pitching this every day for 6 months, but essentially, we're talking about fluids, fats, proteins, vitamins, your microbiome, which is the 100 million friends you have as bacteria in your gut. And we talk about types of diet and intermittent time-restricted eating. So I'm going to give you the overview of this. Why is it the diet's so incredibly important? Because you're changing the soup in which prostate cancer cells can grow. And we're trying to change the soup so that the slow-growing cells don't turn into the fast-growing cells. And if you eat antioxidants, which is the fruits and vegetables, they mop up the damaging and stimulating chemicals. So you're mopping up the damaging stuff there. You turn off the cell signals, and especially if we can get you into a euglycemic state, we're not having these big spikes in the sugar and so on, improves immune function. I think that when we have a healthy diet, we have an innate capacity to kind of fight off cancer. Now, I can't say it's going to cure you, but at least you maximize your probabilities. Okay, so principles of a healthy diet. This is classic. Eat food, mostly plants, not too much would be the takeaway. I think about it having at least 50% of your plate as veggies. It might maybe even eating your veggies first. This is the type of stuff we go through. The healthy complex carbs allow for that kind of slow burn of the sugar into your bloodstream. We're talking about healthy proteins, healthy fats, typically from non-meat sources. So less meat or no red meat, healthy fluids and fiber, nutrient-dense foods at each meal. I like the kind of combination interactivity with lots of different foods at each meal. So you get the synergy of those healthy foods, the minerals and vegetables. We're pushing vitamin D. All you guys, if you're listening to this, should be on vitamin D, 1,000 to 2,000 international units per day. Ultimately, though, what we're trying to do is get you into a diet that you enjoy and that you will comply with for decades to come, right? So it's no good us saying this if you don't actually enjoy eating and the dishes that we may help you prepare. I tease about the big 4 food groups here: fruits, veggies, whole grains, and then the legumes, beans, and seeds, because those are really healthy proteins. We're going to get you out of this kind of swapping out the sugary stuff and getting in the healthy stuff. So the healthy swaps is going to be part of PC-PEP. Sugar-feed cancer. Yes, I just talked to you about increasing insulin, increases inflammation. And so what we need to do is make sure that we have the slow-burning fuel and protein and fiber, healthy fats while you're eating your complex carbs. It's easy. Your gut will like it and you'll know that you're feeling better there. Yes, stay away from that that actually should be like carcinogen, the POP stuff. Okay, little or no red meat. Yes, I won't be, we're not too religious about this, but it really, I mean, the data is there, right? So the red meat can irritate your gut, changes the bacteria, leads to more inflammation. It's just the truth of it. We do endorse some fish. However, you have to watch out for fish high in the food chain that have the high heavy metals in it as well. Yes, you can have some chicken or turkey, but it's like small amounts. That's a smaller portion of your calories. I think that's the takeaway. So myth, we don't get enough protein if we don't eat meat. Well, I guess full disclosure, we are vegans. I seem to be feeling really healthy and strong these days. The vegetables actually contain the same amino acids, which is the building blocks for the protein. So you think of a bull. Bull is eating grass every day, and they're pretty darn muscly, right?
So are horses.
Yes. Nuts, beans, seeds, legumes. That almost like sounds like a rant or something like that. A rap.
You could turn this into a rap.
Yeah. So the point is, if you have a balanced diet, you have more than enough protein for what your body needs. I'm just gonna have a little sip here.
Yeah.
Because my lovely wife suggested I keep on drinking water throughout here. Healthy sources of protein. There's lots.
So excited. He forgets to drink water. He forgets to eat.
I'm like, come on, gotta teach. So yeah, there's lots of options for protein, right?
And during the programming, we elaborate on all those things. Rob is going now like a train running, 300 kilometers an hour. But imagine every day you're in our home. In fact, this is the actual setup.
Yeah.
And you get access to those 2 nuts every day for 6 months. So you really get to find out a lot of things are happening in here. And we're talking, every time we introduce a new vegetable, a new legume, a new fruit, or we talk about any kind of research that has been done to connect it with decreased inflammation in prostate cancer patients. So it's translational, medicine translational science, but incorporated in normal living, because we might be 2 nuts, but we're normal people, right? We have to raise one leg to put the trousers through and then the other. So really that we're so much more like that and different.
Right.
And apparently we're funny. I don't know how that happens, but I'll let you be the judge of that.
We're having a good time at least. So there's lots.
That's for sure.
Come join us. We're having fun. So there are a lot of different vegetarian protein sources. I think that's it. And
I'm biting my tongue. I could come and jump in at any time.
Yeah, I know.
I'm really hard on this.
Yeah, because we're trying to really give you a good, efficient download. I'm having to hold back. Who's like super knowledgeable and knows this stuff inside out. Anyways, thank you, Hun, for your patience.
You're welcome.
So whole grains is much healthier, right? And also has the slow burn of the complex carbs. There's lots of options there. And we take a whole week to talk about those. Supplements.
More than a week.
Oh, yeah, agreed. What you need, vitamin D. Did I say vitamin D?
Yes, you did.
If you're a vegan or a vegetarian, you probably need your B12 as well. We'd also suggest you go to your family doctor and make sure your blood levels are measured, because that's the only way you're going to actually know if you're getting enough supplementation there.
Yes.
Big picture though, if you have a diverse and balanced diet, you will get enough of the micronutrients from the diet. So obviously at every point, we're going to say, make sure you talk with your physician, family doctor, individualize it for your situation. Healthy fluids. Again, this is like a 5-minute talk by itself. However, keep hydrated. The teas are super healthy. They're anti-inflammatory. Yes, lemon water. Sorry, guys, you're really less alcohol is better alcohol is really the kind of the takeaway. And there are some kind of dairy replacements here as well. Coffee, no, coffee is not bad for you. What I would say, though, is that you drink it early in the day. The half-life is about 5 to 8 hours, depending on your metabolism. So take it early in the day so you're not kind of waking yourself up at night. And this program is about you really enjoying your life, not kind of restricting yourself. Fat is bad for you. It used to be like fat is bad, but now it's actually bad fat is bad. Healthy fat is good. So the trans fat, saturated fats are not good, but we're talking about a fatty diet is actually good for you that will actually help your brain and nerves and many other cells. So we teach you around what are those healthy options in terms of the oils and fats there. So for instance, I happen to be like an avocado person. I'm trying to cook with it mostly because of the high.
There's lots of magnesium. Actually, it's really good for you, especially if you work out, taking some magnesium. It's a wonderful supplement for your body and for your muscles to recover, especially after a very heavy workout.
Yes. Yeah.
So you're doing great because you work out every day. It's really good for you.
And I'm not going to take you through the entire omega-3 story, but essentially, if you have more omega-3s in your diet, it reduces inflammation. The omega-6 is kind of the opposite. And so that you can actually get this through, like, for instance, flax, walnuts, chia seeds, small amounts of green vegetables. Actually, sounds like my smoothie from this morning actually had a lot of that different stuff. So anyways, healthy. Microbiome. This is science that you should know about as well.
Our friends.
The bacteria in your gut doing a whole bunch of stuff for you and your life and your body. It's like, it's one microcosm, right? It's bacteria plus your body working together.
And our gut and our brains are connected.
100%. So we're trying to stay away from the processed, the refined foods that kind of change the makeup of our bacteria. And if we have too much of the crappy food, it irritates our lining, something called leaky gut syndrome, adds to inflammation. Stay away. What you want to do is feed your bacteria with fiber so that it has something to grow on. And then you can actually ingest some good bacteria, making sure it's from multiple sources and not just one kind of species.
Yeah. And of course, there's dairy probiotics, but there's non-dairy probiotics, like, pickled cabbage, for example. It's fantastic for you.
Sounds like
kombucha.
Sounds like the program, which it is. A friend of mine who's going through a prostate cancer diagnosis sent me this article yesterday about how our microbiome may actually influence those changes, the kind of genetic changes that predispose to worsening cancer, right? So they're talking about production of prostate cancer and worsening of prostate cancer.
It's a very prestigious scientific journal. It's a platinum journal. So this is good science.
Yeah, exactly. This is what we're learning.
Yeah.
How are we going to do this for you? You sign up, and then every day we email you and we talk to you and we teach you, right, how to transform your diet. You're not going to turn into a perfect diet overnight, but over 6 months, we can actually help you get a better diet, not a perfect diet, a better diet. And we're yakking at you as we are right now, reminders, the science, et cetera, et cetera. And then interestingly, so each week has a theme. So for instance, we start out early with the healthy swaps, getting away from the sugary stuff and swapping in the healthy stuff, healthy fluids. Big time anti-inflammatory diet and the elements of that. Frozen foods, that so many elements to what you can do to change your diet that will taste good, make you feel stronger, and decrease your risk of having a progression of prostate cancer.
I was looking at the slide and I said, he forgot to tell them that we have a weekly cooking video. It's a plant-based dish that we do. I'm bossing Rob around in the kitchen, which is behind this camera. So easy. Even an oncologist can do it.
I'm not a very good chef or cook or whatever. So it's fun to watch me kind of stumble through all that and learn some dishes.
And we have some online cooking videos, some strength exercises, classes online as well, in addition to live video conferences. But we'll tell you all about that in a second.
The live video conferences, we do actually, it's Q&A, but we also update around dietary side of things as well, right? So you join the program, you become part of the community. Okay, this I want you to take home. So you knew diet was good, but you may not have known that time-restricted eating is very important. So not just what you eat. So you don't have to change your diet, but if you change when you eat, you can have a profound influence on your health as well. So just to give you the kind of idea there, when we eat a meal, the carbohydrates, the sugars go to the cells, they go into the liver, get stored up there. The fatty acids go to the cells as well, they get stored as fat cells. When we stop eating, we're burning off all that stuff in our bloodstream. We're burning off the glycogen, which is the glucose in the liver. And then at some point you kick in and you start chewing down your fatty acids, your fat, to produce ketones, and ketones are the source of energy. You want to get to the ketogenic state, not a ketogenic diet, the ketogenic state, right?
Ketosis that happens in between.
Yes. And it's cycling. It's not just ketogenesis all the time. It has to be sugar, then ketogenesis, sugar, and ketogenesis. Like that circle, circadian rhythm is so important. Why? Because when the ketones are released, it actually primes a whole number of cell functions, improving, for instance, your brain cells. It eats up the little bits that are causing inflammation. It kills off weak cells called autophagy. Anyway, super important that you get into ketosis every day, every morning.
There's so much science around this. I mean, really. And when you stand and think about it, the nervous system, the body is very economical. So you look at all those cycles that we have in our body. Even when you breathe, you inhale, you exhale. You don't do both at the same time, right? So the same thing with the eating. We need to give our bodies a chance to regenerate.
Yeah.
And that happens during this time that
Ketosis.
you don't eat.
Yeah.
And that's when ketosis kicks in. And now we know from science that you can, regenerate your liver, your other organs,
kidneys, your brain,
your heart. Such an important element.
Yeah. Unfortunately, this talk, we just can't cover everything. It's like we would love to. Anyway, so the takeaway is you eat during the day, you don't eat at night.
Right.
And if you do that, it actually changes the metabolism, right? The sugar, the insulin, the fat production, better blood pressure. And then as another cue, try not to eat for the first hour after waking, and try not to eat for the last 2 hours prior to going to sleep. Yes, you can have your coffee or tea, but no calories for that first hour after waking. Again, this is good for you. The aim ultimately is to try to build yourself up to maybe 13, 14, maybe 15 hours overnight when you're not eating. I'm not doing a great job because I'm so darn busy that I'm eating too late. But anyways, so the idea is to time restrict, and you kind of build up your capacity within the body. So you're training your body. The ketosis does take a practice in some sense. And I just give you an example of how you would do this. I'm not going to read it to you, but essentially like 12 hours of fasting overnight, Monday to Friday. And then you kind of catch up on the weekends, and slowly each month you get stronger and stronger and stronger, so that ultimately you're eating for less time, whatever feels right for you ultimately. So you're working up to 12 to 14 hours at least of not eating overnight. Super helpful. Okay. While you're doing this, you are going to be feeling hungry first thing in the morning. You are going to have a few of these side effects that I'm listing here. It's all normal. Your body's not used to it yet. So that will go away. The kind of hunger feelings will go away after 2 to 4 weeks. You're not hurting yourself during this time. Yes, talk to your physician if you're allowed to do this. But there it is. We already talked about this. Boost immune function, decrease the risk of cancer. If it decreases the risk of cancer, then you want to do this now, right? Decreases weight loss, stimulates brain function, fat metabolism. You're changing your microchemistry and all the potentials for inflammation and so on. Okay, I'm starting to rant. I can just feel it coming here. Exercise. Yeah, so you guys know this already, so I'm not going to kind of go through it, but there's a lot of good science around that. I would talk about habit formation, starting easy and keeping your goal, your tiny habits small, like going for a 3-minute walk every day and accelerating around that. I do want to emphasize this, though. You need to do strength training beyond aerobics. Did I say that right? Strength training beyond aerobics. It's super important. So right now for this month, we're doing a Zoom class twice a week, but I'm going to tell you about actually the program. The other part of this is to stand up on the hour, which is anti-sedentarism. I'm going to tell you why. So here's our prescribed program. Do something that's fun. I think that's the takeaway. That's the aerobic part of it, 6+ days per week. There's lovely Colette and Jerome, who are part of our peppers. There's good science around why this exercise changes the biochemistry, the chemicals, the cells, the genetics. There's a lot of data now around this part of it. I would always say strength training twice per week. You want to get expert advice before you kind of start on this. We'll screen you if need be coming into our program. But the issue is that we have muscle wasting. Essentially, as we get older, we lose muscle mass, especially on hormone therapy, right? And so what you usually hear is exercise 30 minutes per day, but they forget to say strength training twice per week. So the recommendation is at least now more is better, essentially up to a limit, obviously, in terms of just aerobic exercise, but strength training twice per week. So what you're doing is creating a resistance against the muscles. The muscles respond by getting stronger and bigger, and they can do more work. Like my lovely wife, who's starting to work out now, she's getting stronger and in more benefit from each kind of workout. So you're making it slowly progressive over time. You're getting stronger over time. There are different ways to kind of strength train. We're going to use body weights and elastic bands, but there are other ways to do it. And you can do that within the program, whatever works best for you. We do a home-based program that's been proven to be safe, and like 400 people have gone through the program or thereabouts so far. So the muscle cells multiply and get bigger, but there's also a change in the neurology, the neurochemistry. Like all the muscles then start to get stronger and function better. So therefore, you're less risk of having a fall, which is very interesting. Muscles train in one spot and has influence on the entire body. Get through an operation faster. So the strong muscles decrease arthritis and back pain. It actually protects our joints, which is something that was new for me as well. Bone density, and then fat metabolism. I'm just going to say this all very quickly now. So you're changing the calories. More calories are burned because your basal metabolic rate is higher. You got more stuff to burn there. And the sugar gets into the muscles more quickly, therefore less risk of diabetes, less risk of insulin insensitivity. And we burn off body fat much more easily. So strength training, this is in addition to the aerobic side of it. So inflammation can cause both heart disease and prostate cancer. Strength training decreases inflammation, decreases the bad fats, decreases the risk of heart attacks and stroke. There's a lot to this beyond just aerobic exercise. So increases brain activity, we think more clearly, decreases the risk of dementia. You guys can live for many years. You want to try to prevent that. Improves mood. When you use those muscles, it releases myokines, which is like a hormone to your system that makes you feel better immediately. It's the takeaway. So we make it enjoyable. We get expert advice. We start slowly, and we're training twice a week. And we're working all the major muscle groups. And that's what we essentially incorporated within the program. I'm just going to play the video here. So you can see it's 9 exercises you do 4 times over on Monday, and same thing on Thursday.
And rest.
You can see that there's 4 levels of difficulty.
Next exercise is the chest press. You're going to begin by standing with the band attached to the wall.
We'll send you the bands.
The bands to provide resistance, and you're going to press all the way forward.
Yeah.
From here, you want to make sure that your belly button is nice and tight. Once again, keeping that chest strong.
Yeah. So you get an idea that we talk you through these exercises, right? So here it is, home-based. We send you elastic bands. You follow the videos. You can actually do it with Zoom with us right now this month. You choose the levels right, and you slowly adapt the program up for you. So, okay, so there's workout A. So you're seeing a whole body program. You do it in the way that works for you. I want to just touch on 2 more topics briefly, because I think these are very important that you understand this. Sitting is the new smoking. Sitting too much is sedentarism, right? And we're at risk of it because of all of our lifestyles.
Right.
The problem is it increases all-cause mortality. And you can see the diagram on the other side. You can see like literally every organ system is affected by us sitting. It's incredible that the chemistry changes that much fat and sugar metabolism through sitting too much. Yeah. Increases cardiovascular risk, increases cancer. If you hear it increases cancer, then you do not want to do it, right? You don't want to sit too much. And there it is, adjusting for all the cancers. The British Medical Journal published, if you sit more than 6 hours per day, take 4.8 years off your life.
Oh my goodness.
Yeah, which is, per hour, less than a cigarette, for instance.
Again, platinum science.
Yeah.
Platinum journals.
Excellent.
Very good science.
How do we do it? One of the things you're seeing our gent do here is use a standing desk. So I like it. Is it adjustable? Because sometimes you want to sit, sometimes you want to stand, go back and forth. The other one is I like the ritual. Whenever I'm on a phone, I try to stand up between activities. Okay, so just if you're watching this video or you're watching it live right now, if you can just stretch for a moment, I can shut my shorts. Yes. Oh, yeah. Yeah. Just like, oh my goodness. Kick it out a little bit. Oh, yeah. Yeah. Okay. Usually we would stretch, the full 5 minutes, but because it's a video, we're going to keep on going. We teach around sleep science, healthy sleep practices, and we want to do this in a way that is peaceful and not kind of contributing to the stress in your life. Why do we sleep? Because essentially when we're awake, the chemicals start to build up that's toxic to the brain. And there's a lymphatic system that kind of flushes out those chemicals when we're in sleep, especially the first few hours. We consolidate memories and learning, especially in the later hours of the night. So different aspects of the night have different properties. REM allows us to process our emotional experiences. There's some really good science that we share around this. The goal is for 7 to 9 hours of sleep each night. There's the lymphatic system, which is incredible, that the arteries pulse and push the fluids, and it gets kind of scooped up in the system and gets flushed out on the other side. You know, I don't have to say this in terms of how you feel mentally, but you look at all on the right side, all of the risk factors. So you can do all the same things during the day, but if you're not having a better night's sleep, you put yourself at risk of cancer, for instance. Ding, 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 risk of cancer. Try not to go there. Healthy sleep habits. Yes, it's anti-inflammatory, anti-stress. We talk about sleep hygiene, getting to bed at the same time, getting up at the same time, creating conditions for a good night's sleep. Routine is number one for certain in terms of getting up and going to bed. Setting a lights out alarm, writing down your worries, getting up at the same time. So yeah, so we're avoiding the stimulants. These guys are kind of going to bed and watching TV at the same time. Wrong. You want to kind of clear yourself from screen time a couple hours beforehand. Staying away from heavy exercise and heavy meals. Right. Caffeine, alcohol. In fact, sleeping pills do not maybe get you to sleep, but does not improve the restorative qualities of the sleep. So we're trying to stay away from that one as well. So we mimic light. I like using eye patches myself, blue light blockers, staying in the dark, and then exposing yourself first thing in the morning. And then lastly, the ideal sleep conditions, right? So something that you can potentially control is the sleep side. So I apologize if I went through that quickly, but at least I want you to get the principles, and you can watch this video again to get all the details. And now over to my lovely wife.
So there has been quite a bit of, science published around this issue of connecting mental distress, anxiety, depression, and prostate cancer. Not only a diagnosis, but during treatment and after treatment. So you might say, well, what's the connection between the two? What has science found with regards to how our mental state affects the diagnosis and affects our overall quality of life? Well, number one, we know that a prostate cancer diagnosis can bring quite a bit of anxiety with it, which could manifest as anxiety, depression, or both. We also know that a prostate cancer diagnosis affects our quality of life. So we know that there are urinary issues, especially after surgery, but also radiation and hormonal therapy. There are side effects such as erectile dysfunction, fatigue. People have trouble sleeping. Their relationships are suffering. So these physical challenges, of course, bring with it a lower quality of life than pre-diagnosis. Then there is the whole thing about uncertainty and fear. We all know, and especially you gents would know what happens. You get the treatment and everything, and then you have those checkups. But they can be very stressful because they check your PSA and you don't know, is it going up? Is it staying the same? Is it going down? Which is what's happening. And of course, that brings with a lot of anxiety and could lead to depression as well. There's issues around social isolation because you don't want to talk to anybody. You don't want to go to, say, your church, group every Sunday and say, oh, by the way, I have prostate cancer. People are going to say, it's not a topic that it's easy to bring up, right? Mm-hmm. Then there's the issue of coping mechanism, which connect mental health with prostate cancer, because oftentimes when people get either depression or anxiety, symptoms, they may be turning to unhealthy coping mechanisms. Yeah. You might say like alcohol, drug use, and other things, right? And we also know from science that there is reduced treatment adherence, right? When people have high levels of mental distress and mental health issues. So yeah, there is a connection. And then we know there's burgeoning science right now, really linking mental health with prostate cancer outcomes post-treatment. So we know there might be a biological connection. There was a paper that was published in 2019, another one in 2020 by Verviha and colleagues that show a biological underpin. And then there is the issue of healthcare disparities, right? Disparities in access to healthcare, including mental health support and cancer screening, and they can impact marginalized populations disproportionately. So these disparities can result in delayed prostate cancer diagnosis and poor mental health outcomes. So a little bit going backwards, 7 years ago, I got a chair in prostate cancer quality of life research at Dalhousie University. And not knowing much about the subject, I decided to ask patients to find out how they were doing. 500 plus now surveys later, I find out that, they have problems with intimacy and sexuality, urinary problems, they feel alone, they feel isolated, loss of libido, they have problems sleeping. And a lot of those issues already existed in the literature. But here's where the shock came to me. Just to put things in perspective, if you go in the normal population and you look at men who've never screened positive for prostate cancer diagnosis, just men in the general population, the rates for depression and anxiety are 9% and 8.5% respectively. What we found in our sample is that almost 20% screened positive for either depression or anxiety. 18% of them had treatment regret. So what we did is we stepped away from the data that we found and that we published, and then we went to independent databases. And they're important because oftentimes what can happen in science is you find a finding that is really perplexing, and then you say, well, that could be a statistical artifact. Maybe the people that I surveyed, had some sort of bias. I don't know, maybe only depressed people took my survey. So we went to Atlantic Pact, completely independent database, the same relationship. We found the same relationship. In fact, we found that men with a history of prostate cancer diagnosis had between 2 to 3 times higher rates of mental distress compared to the men in the general population that never had a prostate cancer diagnosis, even those with other types of cancer. However, when we compared men with other types of cancer with men in the general population, there was no statistically significant difference. Then we looked at the Canadian longitudinal study for aging, 25,000 men in their database, same thing. At the same time, we were publishing the results of those 3 different analyses. In Denmark, a group of researchers looked retrospectively at a huge sample size of 25,000 men, but then they also, I think, they looked at records of 1.5 million men in the country. And what they found is that even 18 years later, post-diagnosis, men with a history of prostate cancer had between 2 to 4 times higher rates of being prescribed medication for depression than men in the general population. So we know there is a silent epidemic of loneliness, disconnect, and mental health issues among men with a history of prostate cancer diagnosis, irrespective of their stage. This is yet another study that just got published. And this is one of there are about 14 studies, that's just this year alone. Because, once somebody finds a finding like us, everybody started looking, right? So now they're popping up from everywhere, in US, in Australia, in New Zealand. I saw a study from India, one from Pakistan. They're everywhere. Another study that just got published in Cancers, also showing the same things. Their conclusion is that a substantial proportion of localized prostate cancer patients continue to experience long-term depression. So obviously, and they're saying, listen, somebody has to do something about this. And we did. So part of the different aspects of the program that we had was also meditation. So what we asked men to do, and you see here on the screen that there is a little device. So we give this device to all men in the program, just as we give the elastic bands to do the strength exercise component. So we asked men in the program to do 10 minutes of meditation with this biofeedback per day. And this is based on science that was done at Yale and Harvard. And also we were able to replicate in a phase 2 trial in our lab. And actually the study just got published in Current Oncology showing that the device actually works. So we just wanted to test. No, we didn't trust Harvard and Yale. We had to do it in our lab. I said, let's see if we can replicate this. And we did. Okay, so there's a lot of hard science around if you give people a monitor, a biofeedback device, and they see their physiology. They see how it transforms when they breathe in a certain way, when they really slow down, that changes the neurochemistry, and it has positive effects on how people deal with stress. Fair enough. Okay, so we put it to test. We asked men to do this. But you might say to me, well, Gabriela, how can meditation with a biofeedback device help? Here are some of the reasons. We know from science that biofeedback can help reduce stress. particularly using mindfulness meditation, which is what we had. So using this HRV device during meditation provides real-time feedback on the relaxation responses. And I said, it creates new neurochemistry that positively affects how you deal with stress. We know that it helps with emotional regulation, things like fear, depression, anger, sadness. It really, over time, patients can learn to use meditation to self-regulate their negative emotions that lead to a higher percentage of stress that is necessary, right? Because we know some stress is good, right? But this is the non-good type of stress. It enhances resilience. So now you know that you have it in you, that you've dealt with, with your responses vis-a-vis stress, and it really enhances your ability to deal with it better. It helps sleep quality, we know that. Increases the mind-body awareness. All of a sudden you realize that you're a body that responds to how you breathe, how you
how you feel after you eat.
How you feel. Yeah. Exactly. It does create a sense of empowerment.
Yes.
It activates something in you that says, I can control this, I can deal with this, and that's important. Again, it decreases mental distress. It helps with pain management. Meditation, when combined with HRV biofeedback, can help patients manage pain by reducing muscle tension and promoting relaxation. All those points, by the way, are all science-based. I didn't want to bother you with references so that I don't make this an academic presentation. He's been cracking the whip. Stop being so academic all the time. And it helps with pelvic floor muscle training. And I'll tell you in a second how that is so. But that's again important. And so here is Rob.
23, 2 quicks before the long hold. Ready, quick, hold up, everything up now, nuts to the guts. Hold hard, squeeze hard, keep it there. And relax everything, completely release. Remember to keep on breathing throughout, not the thighs, not the butt, not the abdomen. Ready, quick, hold up, up. Squeeze hard and maintain. And release.
And this is just a minor clip. I mean, we have explanatory for every week. We explain the Kegels. We explain the science behind it. We do exercises. We have pelvic floor nurses that come and show and demonstrate. And we're particularly proud of this. We have now a paper. If you go on PCPEP.org, you'll see all our publications. But we have, since 2 months ago, we've had 4 more publications, which are not updated. And I'll make sure that I put them up there. But we have about 6 papers right now in various stages of submission, and one of them looks at Kegels, because the randomized clinical trial that we did shows an increase in urinary function, a decrease in symptoms, negative symptoms, and we're really proud of this regimen. It was very well thought out. We drew on the best science that is out there, all randomized trials that have been conducted from a systematic review to date, and the science shows it works. It really gets you dry. So again, back to my point. Well, Gabriela, meditation, pelvic floor exercises, hello, what's the connection? Well, the mind-body connection, this increased mind-body connection can help patients better identify and isolate the pelvic floor muscles, right? And that, of course, helps with the pelvic floor muscle training techniques that we teach. It relaxes people. A lot of people have trouble performing the Kegels because they can't relax. Well, the HRV monitor helps with that. So very interesting how all those, ingredients in the program come together, they melt. And like patients say in another paper that we have right now under review, they said this program is much more than the sum of its part. We call that in psychology a gestalt. There's something that becomes much greater than the individual components. It helps with concentration and focus on the pelvic area. And of course, that leads to better pelvic PFMT. Stress reduction can contribute, of course, to the pelvic floor muscle dysfunction. Breathing control, again, that's another element. Consistency, like any exercise routine, consistency is key to the success of pelvic floor muscle training. All right. All right. So then another component to the program is intimacy and connection. Oh, and you might say, what? You two nuts. What are you trying to enter my relationship with my wife? I've been married for 46 years. No, thank you. Well, again, science has shown over and over again. Remember when I was just giving you a synopsis that, there's mental health is increased during the diagnosis, treatment, and even after, but also relationships men are suffering, right? Their relationships are suffering, especially if you're of younger age, and all of a sudden, you're like, we have a testimonial from a patient that says it just took him from being 50 to 70 overnight.
57 to 75 overnight, yeah.
Just very stressful, right? So we help in terms of what? We talk about understanding different types of intimacy, because there are so many of them. And I used to teach at the University of Toronto over 89 courses in psychology. So I know a lot about sexual, training, about intimacy and connection and the role that they play in health and healing. So what did we do? We translated all that science and made it very palpable, very easy for people. We talk about physical intimacy. We talk about emotional intimacy. How can you be more vulnerable and connect truly, right? Because mutual vulnerability is strength. How do you connect? How you engage with your partner in light of very difficult sensations and feelings that you have during this time? We explore different forms of connection, from social support. And we talk about, we build a community within the PC-PEP program that is global, because we have the program now is available in other countries. So it's not just a pan-Canadian trial now, but it's an international trial. We have sites in New Zealand. We're working with 4 other countries in expanding the program and making it available. We have donors in some countries, and I will not name this particular country, but we're traveling there because there is a donor, and they went to the Prostate Cancer Support Group, the National Prostate Cancer Support Group, very liberal, and said, you better bring this program to all the men in the group, and for free. So we're working with them to make that happen. We talk about community engagement, the importance. Oh, I should tell you, we have another paper right now under review that shows that men that actually attend PC-PEP have 4 times higher rates of attending support groups and the resources that are at the hospital than men that don't. So definitely, because we encourage attendance into a local support group, as you will see.
You guys are super important. Yeah.
If you go on our landing page and you watch that 10-minute video, you will see that we encourage men to, there are patients that are saying, that's what we're doing. We're actually promoting the local prostate cancer support groups, because those groups play a quintessential role.
You
must.
Key
Absolutely.
Partners, guys. Thank you all.
Thank you. We talk about love languages, and we tell people that, listen, you could be talking, Greek, and your wife is talking Chinese, and the two of you are just not meeting eye to eye. So we start, teaching things like, what's the best way in which you meet your emotional needs? They may be different than your wife's. If she likes receiving gifts and you like quality time, then she needs to make sure that she spends enough time with you when you need it to to connect, and that you better buy her whatever she wants. And you know what?
Within budget.
Within budget, and there are gifts of presents. There are other gifts as well. But anyways, it's funny. So you get to see how this can be very funny. We talk about forgiveness and coping. We know that self-forgiveness is very important. Cancer patients blame themselves for their condition, feel guilty about the impact on their loved ones. We review all the literature and make it simple. And we have exercises that make it really easy. We talk about forgiveness to others. So in the daily videos, we encourage a relationship and connection. We have things like Walking Wednesday, call out someone at a distance on Sunday. We have a buddy system. So every man in the program, it's optional, but most men like it and adopt this optional part of the program. They connect with 2 other men in the program, and they have a weekly phone call where they catch up. Hey, how are you doing on the exercise component? Have you listened to those nuts yesterday? Did you hear what they had to say? We have those live ongoing monthly Zoom conferences. Oh my gosh, I tell you, PC-PEP is like Hotel California. You come in, you never want to leave. We have men that have taken the program back in 2019. They're now mentors to new men coming in the program. It's heartwarming. We cook together. We update the science. Every time there's a new study, we talk about it. We give the scientific updates. We have small, large group discussions with the Canadians, with the Canucks, with the Kiwis. We have an LGBT lead and group discussions. We continue the education sessions on diet and all the aspects, including penile rehabilitation, sex education for prostate cancer survivors, and more. And really,
in a way, this is going backwards, but I wanted to show you that this program was designed to last long term. So one of the things that we noticed with a phase 3 randomized clinical trial and the phase 2, we had no attrition. As I said, people come in the program and stay until the end. That's really big, guys, because you look at most apps out there or whatever self-help, programs are there. People really engage, especially if it's free, and then poof, within a couple of weeks, it's gone, it's over. Attrition is so high. So to be in a program like this that is damn intense with weekly compliance surveys, I haven't even mentioned those that keep men accountable, and for them to stay engaged for 6 months, it had to be organic. So Rob and I had to put ourselves out there and do everything with everybody, because we all heal and we all grow together. And this is really one of the last things that I want to show you, but I think probably is the most important part of the presentation. And it's only 5 minutes.
Biggest problem I've had following the surgery was incontinence. And that it's been 5 years now since I've had my surgery. So I had Depends or adult diapers for some time. It's embarrassing. It's not pleasant. If you cough, you sneeze, oops, anything you've had to drink was there. It makes you think, should I try to drink less? But no, I've got to drink because you need the fluids. If you're going out to try to shovel, you got to I used to take a lot of paper towel over the pad, let that get the initial leakage when you'd be shoveling or doing anything strenuous whatsoever. Through this program, there's a different series of Kegels and different exercises, and they're lasting for me about 15 minutes and doing it 3 times a day. And I would say during this past month, I'm about 90% drier.
The surgery had a profound effect on me. And the loss of sexual function had a profound effect on me. So when I started this program, I was struggling, and this program was a way for me to turn it around.
Programs helped me to be motivated in terms of my physical fitness. And so, I'm way less now than I did a decade ago. And when I got my diagnosis initially, it's kind of like a lonely thing. You very much feel that. And how am I going to handle this? How are my wife and I going to handle this? And then to be able to come into a group where there's other people and connect with some other men who've been going through it. We're down the road in terms of treatment. I'm still in the midst of my treatment, but to work with some other men who've had it already, it's been very helpful. One of the effects that I've been experiencing is overnight having erectile dysfunction, where that's never been an issue for me before. And as a result of the hormonal medication, I feel like I've gone from 57 to 75 overnight. And my testosterone level has been dropped down from 100% for someone my age to like 3% right now. And so emotionally, I know I've been much more fragile over the past couple of weeks. And throughout the course of this program, when I did my survey from the beginning to the end, I had a lot of satisfaction at the beginning and less now because of the result, because of the things I'm going through, because of the way my body is readjusting. But I'm thankful I was in this program to help alleviate some of those things that I am experiencing.
It sounds like if you hadn't had the program, things would have been very different.
Yeah, I think so. I know there's times when I've been feeling very bleak, over the past little while, but I think because I'm looking after myself, because I'm exercising, because I'm being very careful about what I eat, all of this is part of the motivation that I received from the program. I'm in a better space. Shortly after my diagnosis, I was looking for supports in the community, and I found a local prostate cancer support group. I went to it here in Halifax, and the guy who sat beside me, his name was Jim, and he talked about his experience with prostate cancer, and he chose a different option than I did. He chose brachytherapy and hormonal treatment rather than surgery. I had my surgery, but my surgery wasn't successful, wasn't able to be completed. And I said, I wish I could talk to that guy who I sat beside in that group. And sure enough, he was one of the buddies that I was put together with. And Jim has been a great support to me. And even over this past week where I was feeling quite down, he wrote me an email and said, how are you feeling? How are things going? And I answered honestly. And I got a phone call from him just a few minutes later. And so that support as men has been really great. And we talk about intimate things. We talk about shrinkage. We talk about lack of sexual function. We talk about incontinence. And this has been great to have that with some other people.
that's something that's not easy for men. I understand.
I don't think it's easy for anybody, but I think for men, and especially for men who've never had that as an issue before. And I think about some of the men I've met who've had surgery and haven't had the nerve sparing approach, and right away they're not able to have an erection. That can be a very devastating thing for people, and it kind of brings a dynamic of loss. And I would say that part of what my wife and I have gone through over the past several months now has been grieving this loss. And it's a funny thing because I present well, I look healthy, but there's a loss still that we're going through.
And what did the program do to help you deal with loss?
I think it helped me just be healthy overall, and then just having the wonderful interactions, the encouragement to be quiet, to meditate, to de-stress, to accept that some things are out of our control, and just to kind of to rest in that has been a good thing for me. I remember Dr. Gabrielle has talked about intimacy, and my wife and I have joked about it sometimes at home, where I say, I need a touch, I need a hug. And I've certainly been, I think, more expressive in my own demonstration. I've always been a kind of a tactile person anyways, but I think even more so since this program.
So, yeah, I mean, we haven't done any review of our own studies. I mean, we would need another 2-3 hours just to review the publications we had just since the beginning of the year.
Yeah.
But just a lot of success. Men lose weight in phase 2 trial, lost weight. When we compare the program with standard of care, we are now in the midst of conducting a pan-Canadian international trial. And this is an implementation trial, obviously. But just lots of success in terms of how the patients feel, their quality of life, better urinary function, better physical function, better mental health and overall quality of life, higher attendance to support groups, less treatment regret, and just overall satisfaction with where they are in this moment. So we really hope that you, at least, even if you don't enroll in the program, who right now it's free because it's still a phase 4 implementation trial. If you don't decide to go into the program, we really hope that at least some of those healthy habits would have resonated with you, that you will adopt them. We're very happy to talk to you. These are our emails, PCPEP.org. We have another program that is just for all forms of cancer, but that's different. That's a commercial program.
CancerPEP.com. I'm very happy to take questions now.
Yes, and we'll stop the recording.
Stop the recording. Yeah.
Thank you, everyone.